someone that's struggling with tinnitus and sleep, we want to avoid a completely quiet environment. So we want some source of sound to help distract the mind or help it fixate less on the tinnitus by having that contrast with another sound.
Today you're joined by two tinnitus experts to answer the question, how does tinnitus impact a person's daily life and what can you do to get better? My name is Dr. Ben Thompson and I'm here with Dr. LaBrec Gomez. Dr. Gomez is our featured guest. She's an audiologist and tinnitus specialist on our team where we've seen over 1,500 patients at Treble Health through a comprehensive tinnitus treatment program. Let's jump into the first topic, which is sleep. What are you seeing with your patients in regards to getting good sleep, falling asleep, and staying asleep related to ringing in the ears?
Most of the issues are related to either falling asleep or they can fall asleep okay, but then if they wake up in the morning 2, 3 a.m., it's really difficult for them to get back to sleep. And so getting that solid 7, 8 hours of sleep is really difficult for patients with tinnitus.
Yeah, and this can be for someone who has ringing in the ears, hissing, tea kettle, different kinds of tinnitus sounds, setting up the bedroom, turning off the lights, going to sleep. It's a quiet, dark room. Tell us more about your day-to-day conversations with your patients who you're working with. What are the kinds of difficulties they're reporting related to sleep?
Yeah. So a lot of times what I'm talking to the patient about is how to establish a healthy sleep routine. What can we do to make this nighttime feel or cause less anxiety for the patient? Because oftentimes patients will tell me, they dread when it comes evening time because they know that bedtime is coming and they're just going to lay in a quiet room and listen to their tinnitus. And so we really go through a plan that's specific to each patient of what can they do before bedtime and during bedtime to help ease that transition and lessen the impact of their tinnitus.
Yeah, one of the modalities that I found over the years to be very effective is something called cognitive behavioral therapy for insomnia. So I understand some of the fundamentals of that, and I found that to be really helpful for our patients. One of those tools being if you're in your bed trying to fall asleep, you have about a 20-minute internal clock. If you are struggling to fall asleep, tossing and turning for 20 minutes, stand up, get out of bed, go to a different room in your house, and simply sit on a chair or sit on the couch and be there bored until you get tired again, and then go back into the bedroom and try to fall asleep and repeat that cycle as many times as needed before you actually drift off to sleep. So that's one tool that I like. What are some of the systems or protocols that you tend to follow when creating the sleep routine for your patients?
Yeah, as you mentioned, I think CBT exercises are wonderful when it comes to improving sleep. And this is something that we do well at Treble Health is finding exercises that fit the patient. A lot of times I like the PMR or progressive muscle relaxation. I find that tends to be very popular among patients, and that involves kind of working from the bottom up, tensing your different muscles groups and then relaxing those muscle groups. And it really does help to calm the body and the nervous system and help you kind of ease into sleep easier.
So in my understanding, the progressive muscle relaxation is kind of laying down either on a yoga mat or potentially a bed if someone's doing it right before sleep, and then they tense different parts of their body, sort of like squeezing the muscles and then releasing, squeezing and releasing, and kind of locate different parts of their body. Is that what happens in these kind of sessions?
Yeah, that's exactly right. So you're most times it's recommended to start at the feet. So curling the toes, holding that for about 10 seconds, and then releasing it for about 10 seconds. Then you move up to flexing the foot and all the way up to really your facial features and scrunching those up and releasing. And that just helps release the tension that we build in our muscles and our bodies throughout the day, especially when we're under a lot of stress.
I love it because it also takes the person out of their head, right?
Right,
There's no
right.
better way to take us out of our anxiety, head, tinnitus. Tinnitus is so, so focused on the head. It's inside of our head, right? We can't scratch it. We can't necessarily, touch it or anything. So getting us grounded, soothing the central nervous system, calming our body. First, we have to even remember that we have a body and connect to it, right?
Right,
So
right.
that body-based approach, yeah, it's pretty helpful. Have you found that? to be the case?
Yeah, absolutely. And as what you said, I think patients really like the fact that it's something physical that they can bring their mind to, and it helps them take the mind off of the tinnitus. So I think that's one of the reasons why that one tends to be popular around bedtime or for bedtime.
Mind body techniques, it's something that I was introduced to a handful of years ago. Things like mindfulness, guided breathing, relaxation, even things like yoga or Tai Chi. What they're doing here is they're kind of recalibrating the central nervous system. And for those of us who have anxiety, okay, I'll say it. I think most of us have anxiety, that
I'd agree.
it takes us out of our heads and it just settles us, sort of grounds us. Over your years specializing in tinnitus, what have you seen in terms of, these mind body practices?
Yeah, I think it is so helpful to remember that there is that mind-body connection because a lot of times, we see tinnitus as a problem that we just want an easy or overnight fix to, but it isn't that simple. And when we have certain CBT exercises that can help strengthen our awareness of that mind-body connection, it helps patients with tinnitus feel like they have control. And that's something that so many patients with tinnitus feel like they're lacking.
So I'm going to put an image up on the screen right now. We had asked, what's the biggest challenge you face with tinnitus? We asked that to our YouTube community, and it got over 2,000 votes. 31% of respondents said that difficulty sleeping was the biggest challenge they face with tinnitus. What's your recommendation for sound therapy? I've found that to be one of the most helpful tools for people who struggle with sleep. So, what's the really quick takeaway for how to get started with sound therapy to help someone who's struggling with sleep?
Right. So someone that's struggling with tinnitus and sleep, we want to avoid a completely quiet environment. So we want some source of sound to help distract the mind or help it fixate less on the tinnitus by having that contrast with another sound. So this can, I'd say, most commonly and easily be done with just a tabletop sound generator, and you can usually they're preloaded with several sounds. You can find one that you find soothing. That's the most important. We don't want another sound that, some people find white noise, for example, to be irritating. If that's you, you don't want to use white noise. And then the second component is the level of the sound therapy. We want to avoid masking or trying to mask the tinnitus, meaning putting that level of the sound therapy over the tinnitus. We actually want it to be below the tinnitus, but still audible. So that's what we call a mixing level. And that's the second component.
Definitely good recommendations for sound therapy. I personally believe, just my personal opinion, that for someone who needs to get better sleep at night, that
Hmm.
some of the more traditional recommendations that we might have during the daytime can kind of be thrown out the window if they help someone get to sleep. I think there's use in medication to help sleep. I think that in certain cases it's okay to fully mask tinnitus if it helps someone sleep, because from everything I'm seeing in the research and the literature, when sleep is affected, even 25%, that it makes it really hard to reduce tinnitus. It makes tinnitus treatment even harder. Would you generally agree that for some cases, completely masking can work to help fall asleep too?
Yeah, I think each case is obviously very different, and the recommendations would change based on the patient. I think there's an exception to every rule. Another big thing that I see is that patients will have the sound therapy on a timer or it shuts off after a certain point. And when patients are having trouble with interrupted sleep and they're waking up in the middle of the night, by having that sound therapy constant and playing through the night, that tends to help them over time wake up less. So yes, I agree there's exceptions to every rule, but most commonly I try to have patients aim for that mixing level. I think that's most effective, but you're right that the priority is sleep and good sleep. So whatever we have to do at whatever stage we're in, that's best for the patient is obviously the right recommendation.
Next, going back to this image on the screen here, what's the biggest challenge you face with tinnitus? 37%, the largest score of respondents, 37% said anxiety and stress is the biggest challenge they face with tinnitus. And this makes sense. The tinnitus is constant. It doesn't often go away. We don't have that much sort of escape from it. The more anxiety, negative thoughts, fear we have or feed inside of our mind, it can actually create even more tinnitus, more intrusive. It can bother us more. We can be more aware of it. And there's a natural protection mechanism in the brain, right? Which I believe it's referred to as the reticular activation system, which is always scanning our sensory information, always scanning the environment, what we hear, what we see, what we feel, what we smell, etc., for potential danger or threat. And tinnitus is incorrectly categorized as a threat or a danger. So through treatment, we show the brain that it's miscalculated things, that this is an incorrect signal. We often find that reducing stress and reducing anxiety leads to less tinnitus. So in terms of this point, the challenge with anxiety and stress, could you share some some feedback from your patients? What are they reporting during your appointments related to their lives, their daily lives?
So what we hear a lot, and I think you would agree, is in what you've described is that self-feeding cycle of the anxiety causing an increase in the tinnitus perception, which then reinforces to the brain that the tinnitus is a threat. It is something that needs to constantly be monitored. And then the more the patient is perceiving it, the more anxiety they're having about it. And then, that cycle continues to feed itself until we can do something to stop it. A lot of times patients will report that even after their first session or appointment with us, their anxiety level goes significantly down because finally they're talking to someone that is telling them there is something that we can do about your tinnitus and not that there isn't anything and you just have to live with it. So that's feedback I've got often is just that first appointment, finally feeling like they found the right place to be given their tinnitus and the severity of it and the impact of their life. That already kind of automatically helps lessen the tinnitus.
I find that sound therapy devices is one of the quickest game changers with anxiety and stress, as well as having a clear path forward and a clear diagnosis for what's going on in their case. Absolutely what you said. The sound therapy devices, I'm holding one up on the screen right now. These provide some soothing sounds that mix in with the tinnitus. Probably the biggest response we get is, oh, just kind of feel the weight off my back here. I feel like my shoulders can relax. I feel less stress because of this sound. It's just easier to deal with. I feel relief. That's the biggest, word we hear. One of the best frames that I've seen on this, frameworks to understand and explain, is that there's a mental and emotional pathway to the auditory brain that can help drive tinnitus down over time. So when someone says, "Oh, I don't really want to do therapy," is that what you mean? It's really not that. What we're doing here is addressing the mental reactions and emotional responses to tinnitus and how there's certain brain pathways. I call it the switch of tinnitus. There's some degree of a dimmer switch on tinnitus that you only get there through the mental and emotional pathways. Therefore, the work of one-on-one sessions with a doctor like you who specializes in tinnitus is so crucial. It provides those fundamentals for the cognitive behavioral therapy techniques. It provides the accountability, simply making sure you're doing what, is needed to be done. And then also the practices, the techniques, the homework between the one-on-one sessions where the patient does have to put in the work. I mean, they have to, to get strong, you have to go to the gym. You can't just think about it. So the CBT part of this does require some active work to get that neuroplasticity benefit. All right, let's move on to number 3. And this is from the poll we discussed, what's the biggest challenge you face with tinnitus? The third most common answer was hearing difficulties. 20% of respondents explained that they have difficulty hearing because of tinnitus. So what are your patients reporting to you in that domain, and how does that change over time through treatment?
Right, so getting a hearing test done in person with an audiologist is so important here because it helps us as the telehealth audiologist better understand how your auditory system is functioning. In some cases, a patient with tinnitus may have a mild degree of hearing loss that they have kind of misinterpreted as having difficulty hearing because of the tinnitus, when really the tinnitus is an underlying or I'm sorry, the hearing loss is an underlying factor in causing the tinnitus, and that's of the cochlear subtype of tinnitus. Oftentimes, a patient could have completely normal hearing on paper on the audiogram and still have bothersome tinnitus, and they might feel like they have difficulty hearing still in noisy situations or more challenging situations. And then a patient may have a significant hearing loss. That's why it's so important for us to know how you're hearing, how you subjectively feel your hearing is, but also to see that test and be able to walk through that with you because I do feel it's so important for patients to understand their hearing test, understand where their hearing is, and how it could be contributing to their tinnitus.
Yeah, and at Treble Health, with our telehealth service, I work on the tinnitus solutions team. And one thing that we do is we meet with patients for a consultation and we review their hearing test. Most patients who come to us have already had a hearing test in the past, so either they'll subjectively explain the results or they will show the actual data, which we then provide them pathway forward towards different solutions that could help them. Yeah, and for anyone who's listening who might want to take advantage of that free consultation, we'll include a link right there on the screen, or you can reach out to treblehealth.com and we can help. That hearing test is crucial because it identifies what is the actual tinnitus cause. Sometimes the low-hanging fruit with treating tinnitus is actually treating hearing loss. That gets the best tinnitus treatment. So using devices like hearing aids or other similar devices on the ears, which can treat hearing loss and tinnitus together, is often the right pathway forward for someone who's experiencing hearing difficulties with tinnitus. A common symptom someone might describe is, I have a hard time hearing people because of the ringing in my ears, or I'm trying to hear people's talk at a restaurant or hear my family member talk from far away, and it's hard to hear them over the ringing in my ears. What's actually happening there is someone has hearing loss and tinnitus. In most cases, someone has hearing loss and tinnitus, and the trouble hearing is because of the hearing loss, but then the tinnitus signal is there, sort of interfering. But if we just treated the hearing loss, that person would be able to hear the voice clearly. I would recommend anyone listening to try this out because you can oftentimes get a risk-free trial of hearing devices for their tinnitus, and that can essentially put this hypothesis to the test, which is how much of your tinnitus hearing-related difficulties could actually just be treated with properly fed hearing aids.
Absolutely.
Yeah. Let's talk on point number 4 here, and let's put up the image again. We asked, what's the biggest challenge you face with tinnitus? And 11% of respondents, this is about 200 people, said that they had trouble concentrating. Dr. Ali, what kind of situations do you find is the most common for people who are having trouble concentrating, and how do you help them?
A lot of times I find that patients are struggling to concentrate at work because usually when we're at work or we're trying to concentrate on a task, we're in a more quiet environment. That then leads us to be more prone for the brain to fixate on the tinnitus. So when a patient is describing difficulty concentrating and they are in a quiet space, that's where either on-ear sound generators to provide sound therapy that wouldn't distract coworkers or other people around you, or if you're in a home office or office where you wouldn't be distracting someone else, just using a top sound generator could help a lot as well in that situation. So work is a big one, and then hobbies that patients enjoy, like reading or knitting, doing jigsaw puzzles, anything that, again, it's typically pretty quiet. Just adding a little bit of sound into the environment can help you enjoy those hobbies again.
Excellent. I do have that sound machine you spoke about. This is the Treble
Mhm.
Health sound machine by Sound Oasis. We put some specific sounds that are the most popular on our YouTube channel, like silk, shimmer, some of our most popular cricket sounds inside of this device. So the beauty about this is that it doesn't need internet or doesn't need a phone to work. It can work independently from a smartphone, and that's why it's so useful for, yeah, during the day, concentrating, trying to work, even reading at home. I often hear from people that reading on their couch seems like it's lost forever, but it's such a
Right,
joy
right.
to get to talk to our patients on the other side of treatment, where they have
Mhm.
said to me multiple times, I can't believe that I'm able to sit in a quiet room on my couch and read a book. A year ago, I thought this would be impossible, and I can't believe I'm here. So we love stories like that, those positive success stories where we know, hey, tinnitus can drastically improve. It's not set in stone. There's room to get better here. I wanted to pass it to you here for any words of hope or encouragement for the tinnitus community. You see a lot of people in your practice working at Treble Health. A lot of patients here have already been to their local doctors. Unfortunately, didn't find a great solution, got connected to a tinnitus specialist, started working with you, getting results. I'd love to hear, based on your real world experiences, what kind of message you have for those who might be struggling right now.
Yeah, absolutely. I think one of the big things to understand is that you're in the right hands if you have tinnitus because you found a team of people that has specialized in tinnitus, and we see tinnitus patients every day, all day long. And so while each story of tinnitus is unique, we're familiar with tinnitus as a whole where we can help guide each patient in their own individualized way because we see every day how much of a positive impact it can have on quality of life. Like you mentioned, when a patient's finally able to read and quiet and get that joy back that they've been missing, that's so rewarding as a clinician to see those changes happen. And the great part is we have patients kind of at each stage throughout the day. So we might have someone in the morning that's just starting with us and someone in the afternoon that's graduating. So seeing the people that cross the finish line, that provides me hope as a provider that we can get everyone there.
Dr. Ali LaBrec Gomez, thank you so much. If anyone wants to work with you, they can reach out to our team, treblehealth.com, and ask for Dr. Ali. We'll talk to you soon, and thanks so much.
Thank you.
If you found Dr. Ali and I's conversation helpful, then just imagine what you could learn from scheduling a free consultation with our team. You can click the link right there on the screen to book a free call today, and myself or another audiologist on our Tinnitus Solutions team will be able to help you. Book a call with Treble Health, or see you on the next video.